Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about some progressions you can do for strengthening the neck area. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially today what I'd like to talk to you about is something called isometric contractions of the neck area. So typically the way I like to use these exercises is after I've started with some deep sort of core exercises with an individual who perhaps has some weaknesses right in through the neck, which might be creating some discomfort, some pain in through the neck region. So in these cases, typically I'm going to be starting off with teaching the patient some deep neck flexor exercises, or some exercises where we're doing some very gentle sort of chin nods, right? Where I'm really trying to activate these deeper muscles and trying our best, right, to keep quiet our superficial muscles in through the neck region. So that might look like your scalenes, your SCM, your neck extensors. So again, some of these muscles that are a bit more superficial, initially I'm going to have the patient keep them nice and quiet. We're going to be activating these deeper muscles. Now, once the patient has a good sense of that exercise, one exercise you can kind of add into that is to actually start incorporating some of the more superficial muscles. So again, initially we want to start with kind of the deep foundational muscles of the neck, activating those, and then from there, right, I'm going to then add in the more superficial ones. And one component of that is something called isometric contractions. And so essentially with this, what I'm going to have the patient do is engage those deeper neck muscles, right? So they're doing their little chin nod, and then they can use their hand to gently push forwards, right? So I'm going into resisting into neck flexion, side flexion, right? So now I'm going to the side on either side there. And again, after each rep, I'll have the patient re-engage that deep neck flexor muscle, and then some extensions back. So it's a nice little progression, right? Once we've had the patient do those and engage those deeper muscles, now I'm going to layer on top of that and start incorporating, right, the more superficial muscles. And I'll typically have the patient hold that for a second or so and then let it go. And then again, work in this sort of fashion where, again, the neck isn't moving, but I'm resisting. I'm engaging here first, pushing, side, right? And then I'm going into that extended position. So those 4 movements. If you have any questions or concerns, feel free to leave a comment below, and please check with a physiotherapist or doctor to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.